When you've treated a patient and you go on to the next one, there is no time to reflect back at that time what happened to the one you treated before. And at the very end of the day, I think it leaves, well, it certainly left me with a feeling of guilt. I didn't know whether I had done all the things that I should have done for each person. I didn't know who they were. I didn't know how they felt. There wasn't enough time to build any kind of relationship with them. And at the end of the day, I was very worried that I hadn't performed in my nursing ability to the highest that I could have done, because of the lack of communicating well with somebody that's been involved in a major disaster.
I think what one finds is that staff experience feelings which are very, very parallel to the feelings which we write up and experience in the patient population. And certainly with an impending sort of disaster, I think a lot of staff do feel really very apprehensive, wondering how they're going to cope, wondering whether they're good enough. And it's particularly helpful if managers and trusted people are able to give those staff a chance, at least to express some of those feelings. One of the things I've found is that people talk about how in the crisis the adrenaline ran and they coped magnificently and, if you like, in a glare of publicity. When they get away, typical reactions would be wondering whether you were good enough and wondering what else you may have done. With doctors and nurses in particular, the lovely fantasy among the public that doctors and nurses, for example, can cope with every emergency and indeed know first aid.
13,000 people were reputed to live here. All became homeless. Innumerable personal tragedies involving loss of home, property and life. The reaction of the people to the disaster, victims and rescue workers alike, was truly wonderful. Here's one who worked tirelessly throughout the ordeal.
We went straight on to rescue work, and we carried on all day and feel that we were instrumental, we and our staff, of saving at least 100 lives.
Typically 2-3 days later, when the adrenaline stopped running, finding that staff too are feeling short-tempered, angry. Where I work, certainly a lot of the anger was focused at the politicians who came in and visited for whatever reason, but it was felt that their presence was sometimes intrusive and that they were taking the limelight. And whether that was realistic or not, I think the politicians focused as a good focus for the staff to get angry. Then to, for example, staff to fight among themselves. The other thing that I think disasters generate per se, as the nature of things, a tremendous amount of interprofessional and interpersonal competition. Which profession is going to be better than the other? And I think at one level you've got to acknowledge the fact that people are likely to be competitive with each other, and if you can acknowledge it and have some good structures for working together, then that helps no end. Where I work, the competitiveness didn't seem to me to be particularly upfront. We did have a coordinating committee which coordinated all psychological care, including staff support.
Well, there were several different types of support groups. The staff could choose what sort of group they went with. They could be in the chaplains group, they could be with the psychology department or the psychiatry department, or with a counselling setup, whichever thing they wanted. And staff were very much encouraged to make their own decisions and to do what they felt they wanted to do. The options were put to them and they decided. I think a few years ago, because we didn't know about these things, we didn't do them, but now that we know the value of support, I think that we should use these support systems, because I think one of the sad things about major disaster is that people carry with them for years the scars of this sort of thing without sometimes even knowing what is causing their anxiety. We do know now that major disasters cause difficulties for people. We know how to unlock that system, and I think that we should use the mechanisms that we know of to do that and to help staff regain normality very, very quickly. And they will, because they're very resilient. Trained people are resilient, and if you give them the bit of help that they need at the time, they usually respond extremely well to it.